Good evening, Andy. My name is Dr. Chalapathi. I'm gastroenterologist at KIMS Hospital, Visakhapatnam. So again, COVID is back. We don't have any personal interactions and education sessions um, because of COVID. I hope all of you are safe. Wear your mask and get vaccinated. Sanitize your hands regularly and maintain social distance. So today I'm here to speak about jaundice. What is jaundice and what are the causes of jaundice and how does it come to us and what are the bad effects and what is the diet that needs to be taken. So jaundice means it is actually the eyes and the urine they turn yellow. That is because of liver problem. Most likely, most often, and most commonly, it is because of liver problem. Uh, so how jaundice happens? Jaundice means if you go back to the blood test, the bilirubin levels will be high. Bilirubin yani one of the blood test done in the liver function test. So the bilirubin levels go up. It can go to 3, 4, 20, 30, 70 also sometimes. So depends on the disease, depends on the condition, depends on the cause and severity. So uh, so commonly it is diagnosed in blood tests or when somebody else look into our face, then they will recognize that eyes are yellow. And sometimes patient also recognizes when he goes to toilet and the urinal, you can see a yellowish urine. So then there will be a suspicion of jaundice. They get tested and come back to us that there is jaundice with the report. So it is because of predominantly liver problem and either liver cannot metabolize the jaundice or it cannot throw out the bilirubin out of the body. So then jaundice can happen. Then it can occur. So this is what is jaundice. So it indicates liver problem. Sometimes it can be because of infection of the liver. Sometimes it can be because of alcohol intake. Sometimes it can be because of any reaction to the drug or any toxin. Sometimes it can be because of any tumor in the liver. Sometimes it can be because of any block in the outflow that is in the bile duct. Sometimes it can be because of stones also. So there are many causes for jaundice, and identifying the cause is very very important. So because the treatment and remedies are directed, and we treat the cause, and automatically the disease comes down, and jaundice gets better. There are many other rare causes, autoimmune cause. Sometimes with COVID also we have seen liver problems, jaundice, etc. Sometimes because of copper iron problems in the body, copper problem, iron problem in the body, we can see jaundice. So how do they come to us? So jaundice patients depends again on the cause. Predominantly patients will have some abdominal like stomach pain, stomach discomfort. Sometimes there will be vomiting. Sometimes there will be nausea. They can't accept food. Appetite will be very low. Uh, there can be fever also. There will be fatigue, malaise, general weakness, the laziness and all. So all these things are symptoms additional to the jaundice and related to the jaundice. So jaundice is just one symptom, and along with that there can be these symptoms: stomach pain, fever, vomiting, nausea, poor appetite, and then malaise, fatigue, weakness, etc. So as we said, it is a symptom. Jaundice is a symptom, but there will be an underlying disease. It is something like fever and malaria. Like for example, if we talk about fever, fever can be because of many reasons, out of which malaria is one of the cause. So we treat fever, but we have to treat malaria also. Only then the patient gets better. So similarly, jaundice and liver problem. So jaundice is a symptom, liver problem, and why it is happening. What is the cause of liver problem? So both has to be treated. So jaundice has to be treated, and the cause of the liver problem need to be identified, and it has to be treated. Okay. So for that, we'll take good history, whether patient had any antibiotics, patient had any Ayurvedic medicines, homeopathic medicines, recent allopathic medicines, any kind of medicine or any toxins people use can use very various other unknown products, unknown medications. knowingly or unknowingly. Sometimes it can hit the liver and it can cause liver toxicity and liver problems. So sometimes patient can get infection if there is any fever like that. So all these things at least we'll ask in the clinic, and depending on that we run our tests, and depending on that we'll take blood test, we'll take urine test, we will take ultrasound test to look at the liver. We'll also take some new tests like fibroscan. Like we have fibroscan at our hospital. So what is fibroscan? Fibroscan is is a advanced test wherein we can diagnose the liver problem very early and very easily and very fast also. So it is different from ultrasound scan. So it will say how much stiff the liver is and how much fat is there in the liver. Sometimes now fatty liver is a big problem. So with fat quantification, percentage of fat also can be given in the liver, and also how much damage that liver has got, and how much stiff the liver is there. So these things can be, we can get a good detail uh, on fibroscan. So depending on the test like blood test, we'll run liver function test, we'll see platelet count, we'll see kidney function test, we'll see any other viral infections like hepatitis A, hepatitis B, hepatitis C, hepatitis E, or any other autoimmune problems like that, depending on case to case. So identifying jaundice is important, but identifying the cause is even more important. Why? Because we need to identify and treat the cause, otherwise the jaundice can keep coming back. So that is very important. So not just treating the jaundice, but also identifying the cause is very important. So um, that is one thing. And associated with that, we have to assess whether liver is just affected or damaged. So both are different. So liver is damaged, then we'll actually have to be more aggressive in treatment. Sometimes patients can have an advanced liver problem, which is called cirrhosis. So it is a permanent liver damage, advanced liver damage. Then patient can have water in the stomach, patient can have bleeding, patient can have a thin blood, patient can brain can get more sleepy. They can be disoriented. They will be sleep wake cycle. Everything is disturbed. So all these things are signs of advanced liver problem. So sometimes patients can have swelling in the feet, swelling in the stomach, a lot of problems. So these are all advanced problems. So we need to identify whether liver is just affected or damaged. So very important. So other than that, how do you treat it? So we have a lot of symptomatic treatments, so that we see that the bile flow is maintained, the bile, the bilirubin is thrown away from the body, and internally the bile metabolism is changed. Like that, we give medicines so that person can get rid of jaundice. But as I said, we have to treat the cause. So if it is alcohol cause, we ask them to stop. We'll wait. We'll give supportive therapy, and then patient gradually recovers. And if there is hepatitis, like hepatitis B or hepatitis C, if there is jaundice, we treat that. So hepatitis B, we have effective medications by tablets, we give them. Hepatitis C, it is a definite course, like 3 months, 6 months, we give the tablets, and patient gets cured of hepatitis C. So identifying cause is very important. So if there is any drug exposure, medicine exposure, toxin exposure, then we'll identify them, and then we advise the patient to stop all these medicines so that the further ongoing liver damage and further progression is prevented. So then patient can come back normal. Okay. So other than that, rare causes will be there. Sometimes by birth inherited causes can be there, congenital causes can be there. Further special tests need to be ruled out. Metabolic problems, congenital problems, all needs to be identified. And other problems like autoimmune problems can happen. We need to identify them and treat the autoimmune problems like that. So apart from that, there is a frequent question about the diet in liver problems. So whenever there is jaundice, there is everybody will think like there is need for diet restriction. So lot of superstitions are there, lot of beliefs are there, lot of customs are there, which are being practiced for many decades since our forefathers. You should not do this. You should not eat this. You should not do this like that. So, but what I mean to say is, it is not advisable to follow strict diet restriction. Just avoid some heavy oily food, outside food. Eat good amount of balanced diet, protein based diet, carbohydrate based diet, and you need to eat frequently so that your energy levels are maintained. So sometimes because of the diet restriction, patient goes down, patient gets weaker and weaker. So it is not because of the disease, it is because of the diet restriction. So if you restrict the diet completely, then it is a problem. Patient goes down very, very fast because there is no energy. Because liver is a energy factory. So if liver is damaged or liver is affected, if there is jaundice, then liver is not able to perform that energy function. So body needs that energy. So you need to eat frequently, regularly, without any restriction. Okay, so that is one advice. And how to prevent this jaundice? You have to be careful. Whenever a doctor writes, or any quack, or any local doctor, or any other person, even some people take medicines from a local medical shop. So please ask whether this damages liver or not. So if some, as I discussed, all these medications sometimes they can cause liver problems. So you need to ask your doctor or whosoever is prescribing to check whether it affects the liver or not. Because in future, after using this, liver can get damaged. So that is one thing. Stop alcohol, a big thing. Those who are alcoholics take support from family, take support from doctors. Should stop alcohol. So alcohol should be completely strictly stopped so that the damage is stopped and then patient will recover. Similarly, hepatitis viruses. So you eat clean food, clean water to prevent hepatitis A and E. Hygiene is very important. And for hepatitis B, you have good vaccine. So if you take hepatitis B vaccine 3 doses, then your hepatitis B can be prevented. So automatically liver damage or liver affection can be prevented and jaundice can be prevented. Again, hepatitis C, it is predominantly transmitted by tattooing, by body piercing, by harmful injections, IV drugs like that. So avoid all these kind of high risk behaviors. Check and sometimes in remote places in countryside, a lot of these injections will be given left and right without any proper sterilization. Very important. We should stop it so that these kind of infections cannot be transmitted, especially hepatitis C. Another thing is about when we go to saloon, that they will use the blades. So please check that it is not a reused blade; it is a fresh blade opened for you, and it has to be discarded. So it should not be reused because you don't know what infection does it carry. So always a fresh blade. Otherwise, you take your own blade, give it to the saloon person, and then he will use it for you. So very important. So be careful. Do all these practices. Please follow whatever I have told you. Uh, Follow your local doctor advice and keep a check and track on your LFTs, the bilirubin levels, whether it is going up, whether it is coming down. So what is the cause of it? Not just jaundice. You please ask your doctor why is it happening. So unless you get an answer for that, your doctor has to investigate. You have to investigate. Please be careful. If you have any kind of such exposure like alcohol or drugs or any medications, so you have to come out with that. Otherwise, doctor cannot identify the cause. And unless we identify the cause, we cannot treat the jaundice completely. Otherwise, it can keep recurring. So that's all for today. Hopefully, this session helps for you to understand about the jaundice. We discussed about the what is jaundice. We discussed about the causes of jaundice. How does patient presents and how we can identify jaundice. How we can treat jaundice and the cause, and how we can prevent jaundice by identifying the cause. So please remember, jaundice is just a symptom, and liver disease is there. That's why there is jaundice. So please identify the liver disease, and then only the complete treatment for jaundice can happen. So please be safe, all of you. As I said earlier, wear your mask, and then maintain social distance, and also sanitize your hands regularly. Okay. So see you in next session. Thank you.